Department, we were having some technical difficulties. With us today, we have Nita Ludwig at the Rock Island County Health Department and Ed Rivers at the Scott County Health Department. We also have added a American Sign Language interpreter. So we ask that when you show this on your broadcast, that you make sure that the interpreter is being able to be seen also. Brooke sent some guidelines earlier. I'm just going to look at them quickly. Make sure that any to ensure that the ASL interpreter is easily visible during the recordings, please use the gallery view option in the top right-hand corner of your Zoom screen. And then in the video settings, next to the camera button, hide non-video participants. This will ensure that only our speakers and the ASL interpreter are visible on your screen. Okay. Both Ed and Nita have prepared remarks today, and then as always, we will take questions at the end. Brooke is not here today, so I will be facilitating the question section. So Nita, let's start off with your numbers, and just give us a second. We're going to switch spots. Thank you.
Thank you for being patient with us. So unfortunately today we are reporting 2 additional deaths from COVID-19, and it saddens us greatly that we've lost 2 more community members to this virus. And because of that, we urge everyone to take the proper precautions to protect yourselves and those other vulnerable residents in our community. Our other numbers for today, we are reporting 14 new COVID-19 cases, which brings our total number of cases to 530. And the 2 deaths added today will make the total 16 total deaths for Rock Island County today. There are also 20 people currently hospitalized in Rock Island County with COVID-related illness. And there are now 101 confirmed cases of COVID-19 in Tyson workers in Rock Island County. Thank you.
In Scott County, our total cases are 260. That's an increase of 5 today, with 3,012 tests. That's about 8.6% positive. We have had no further deaths. Thankfully, our count remains at 7. So I'd like to start off today by thanking each of you as members of the media for sticking with us these last several weeks. We know that the topic of COVID-19 is newsworthy. We also know that many of you have taken time to find the most actionable information and share it with the community. One of the risks we run into with a long-term health crisis such as this is message fatigue. Our public health messages have not changed much since we first began speaking to the community about COVID-19 back on March 9th. But we can't afford to have our community lose interest or stop listening to our messages on what we must do to keep this virus from increasing its spread and severity in our community. We need your help now more than ever. You play a vital role in establishing the narrative about what is discussed in our community. We ask that you help us by keeping our important messages in front of the community. And those messages are: keep distancing yourself from others, stay more than 6 feet away, and that is so important. Wash your hands and sanitize surfaces around you. If you start to show signs of illness, stay home and stay away from others, because these are the only things keeping the virus from increasing its spread. We have an additional reminder for our community. We know that residents have done their part by supporting local restaurants through drive-through and curbside orders. Your support is making all the difference for those businesses. However, based on state requirements for both Rock Island and Scott counties, we are not able to bring the social aspect of dining back into our restaurants at this time. Please support local restaurants by following the guidelines and not hanging around to eat or drink any of what you buy while you're in the restaurant or immediately outside the building. We encourage all restaurants consider how they can rearrange outdoor seating and any setups inside their building so that people do not gather to consume their food. All this virus needs in order to spread is for individuals to be close together. We all look forward to when we can sit down and enjoy the company of family and friends at our local hangouts. And that time will come, but it is not now. Thank you.
So we wanted to talk a little bit today about how many people are working on this pandemic response in the Quad Cities. You know and now see both Ed and I, along with our public information officers, every day. However, thousands of Quad Cityans are working tirelessly to make sure that you get the health care, supplies, food, shelter, information, and leadership that you need. Your water is still coming to your house, your trash is still going out, bus drivers take people to and from their essential trips, pharmacies, grocery stores, restaurants, gas stations are all still operating, and those are our frontline workers as well. Police officers and firefighters still jump in to help when you call. Healthcare, all first responders and public health workers literally put their lives on the line for yours. Journalists too work for the public good, and we are putting in long hours in less than safe situations to keep our community informed. We thank you all. From the beginning, leaders in government, business, and other nonprofit sector kept a hopeful eye toward returning to normal. And from the beginning, we have said that our states our states may take different approaches. And last week, we heard about Iowa's recovery plan by Governor Kim Reynolds. And yesterday, we learned from Governor Pritzker about the Restore Illinois campaign and the phases that will take place in Illinois. The governor's plans are different and don't seem to take into the account the specifics of our unique bi-state community. Illinois is taking a measured approach to reopening. Rock Island County is part of a region that includes more than a quarter of the whole state, from just beyond the western Chicago suburbs over to Rockford, to Galena, down to the Quad Cities and Macomb, and over to Peoria and Bloomington, and then back up. The governor's plan is for the entire region to move together from one phase to another. The counties will not move individually. The entire state is in phase 2 now, which is called the flattening stage, and phase 5 is the full recovery phase. We must meet every milestone before reaching phase 5. Local leaders in each county will have some input, but the final decision to move to the next phase lies with the governor and his team. But you have the power to influence the governor's decision. The Quad Cities could be a bright spot in the huge region if residents take the messages we've been saying for weeks now to heart. In fact, Ed already has given you your daily reminder to remain his social distance and wash your hands, etc. Just know this, your personal decision will affect more than just you. Please choose wisely. Thank you.
Vanessa, this is Shannon. I'm going to have to ask you to do the questions because I cannot see them and maintain social distance from Nita at the same time.
Currently, I don't see any questions in our chat box. We'll give it a few minutes or a little bit of time to have media put in their questions.
We did receive some early. I don't have those in front of me. Let me see if I can pull them up on my phone.
Well, while you're looking, Janet, I will just say that, and we have shared this before, but the long-term care centers or nursing homes, their outbreak numbers are shared on the Illinois Department of Public Health website. So there are the long-term care facilities on the Illinois side of the Quad Cities. Those are at the Illinois Department of Public Health website.
Okay, one of the first questions was for Nita to walk us through the 5-phase plan and what will be the driving force when moving, through how public health will be the driving force when moving from phase to phase.
Sure. Well, we're currently in phase 2. Phase 1 was the rapid spread of the illness, which we've all been experiencing. And phase 2 is where we're at now with the governor's order as of May 1st, with the face coverings and social distancing and still having essential businesses open. And moving through the phases will depend upon the health metrics. And that plan is based on key health metrics like positive test rates and hospital capacity, admissions, that sort of information, and that the Illinois Department of Public Health will be the one to assess and determine when it's safe to move the region to the next phase. So it's not Rock Island County only that will make those determinations, but that whole big region that I mentioned to you that goes all the way up here to the western suburbs and down to Peoria and Bloomington.
The next related question was what health metrics will be looked at?
And I think I might have just said that. So that's the positive test result rate, the positive test rates, and hospital capacity and admissions.
Okay. Could you please give us an update of the number of COVID-19 cases and deaths tied to the Tyson plant in Joslyn, both for Rock Island and Scott counties?
So I gave that number as 101 confirmed COVID-related illnesses for Rock Island County residents. And Ed, if you want to speak to Iowa.
Yeah, as we've said before, the Iowa Department of Public Health provides guidance on what information we can share or verify. And we're not able to provide information on cases linked to any businesses in Iowa or other states other than those identified by the Iowa Department of Public Health, and they have not identified Joslyn.
Okay. Another question is, how many Rock Island and or Scott County residents have confirmed cases or deaths related to other meatpacking plants, including in Whiteside County and Warren County, Illinois? And yes, those two.
Okay, so I'm going to take that first. So we do know that there are at least a couple of Rock Island County residents that work in some of the meatpacking plants in other counties around us, but those are meatpacking places in other counties, so the outbreak belongs to that county, say Warren County. So we do not have hard numbers for their outbreak at all. And while I know these outbreaks are of particular interest, and I know that they are significant, especially Tyson in our area and our long-term care centers with our vulnerable populations, I would like just to emphasize that there are still over 450 positive cases outside of Tyson and nursing homes in the Illinois Quad Cities, and they could be your neighbor, they could be someone you ride the bus with, they could be someone working at a takeout restaurant or a pharmacy or a grocery store. So I really want to emphasize the importance of just staying vigilant and making sure to protect yourself with face coverings, washing your hands, keeping that social distancing going. That is all very relevant. This is a widespread virus in the community, and you just need to assume that everybody may have it that you come into contact with.
And I believe you answered the Scott County part earlier. Is there anything to add regarding out-of-state outbreaks where Scott County residents could be impacted?
Not out of state, but we can say that Scott County has 7 cases linked to the Columbus Junction Tyson outbreak.
Okay. If information has been made public, are there any other clusters or outbreaks in Rock Island and or Scott counties? And if so, how many and where? Nita?
Oh, sure. I'm sorry, I wasn't sure if that was for me. So the Illinois Department of Public Health does have information on other outbreaks, but like I just mentioned, I think really the important part is to know that an outbreak is 2 or more persons in a related area. So you just need to really assume that it's everywhere you might go and take those precautions to protect yourself when you're out in public.
Yeah, Anita's quite right about that. But the Iowa Department of Public Health has not identified any business or long-term care outbreaks in Scott County. The information is updated on the coronavirus.iowa.gov website, and typically Governor Kim Reynolds has announced these in her daily briefing.
Is outbreak defined as 2 or more in Iowa also?
For businesses, they have set that bar at 10% of the workforce. For a long-term care facility, I believe it is 3 residents.
Okay. Vanessa, do we have any other questions?
We do, and I think this one is for Ed. Going along with Test Iowa, when will the test site be set up in Scott County?
Well, if you've driven by North Park Mall, you may have seen the tent set up, but we don't have information on an exact start date. We've been asked to direct any inquiries about Test Iowa program to the governor's office. They want to be sure that information that is provided is accurate.
Thank you, Ed. It doesn't look like we have any more questions along in the chat box, and so I think we will conclude for today. Please look for another email from Brooke on future press availabilities and briefings, and thank you for joining us today. Have a nice day.
Thank you.